Hi everybody, my name is Knapp, and I did my EBP project on the topic of adolescent obesity. As previously mentioned in steps 1 and 2 of my project, obesity among children and adolescents is a growing epidemic in the United States of America. According to the Centers for Disease Control and Prevention, in 2012, more than 1/3 of children and adolescents were overweight or obese. By being overweight and obese, children and adolescents are at a higher risk for chronic health conditions which will continue into their adulthood. Currently, I am a pediatric nurse in a busy inpatient unit at Penn State Hershey Children's Hospital. I have seen numerous obese children and adolescents who are admitted for conditions related to their obesity, such as obstructive sleep apnea, constipation, and complications of diabetes mellitus type 2. While my role as an RN in this institution involves bedside nursing in the acute care setting, my future role will be the primary care provider of pediatric patients as a nurse practitioner. I hope to take a proactive role in the lives of these patients and help prevent a lifetime of chronic health problems. As a future primary care provider, I want to know the best route of care to give my patients. Currently, there are no guidelines pertaining to pharmacological therapy to treat adolescent obesity. Therefore, the PICO question that I set out to answer was, during a 6-month time frame, do drug treatment regimens reduce weight in obese adolescents ages 12 through 18 compared to placebo regimens? Literature review, critical appraisal, and results. Throughout my search of CINAHL, ProCrest Nursing, and Allied Health journals, the Cochrane Library, PubMed, and the Nursing Research Center for the most relevant research articles, I found 8 final articles that I felt truly pertained to my PICO question. My search terms included pediatric obesity or childhood obesity, drug regimen or pharmacological therapy, placebo or no therapy, weight loss or reduced weight or weight management, and 6 months. I only searched for randomized controlled trials, RCTs, because they produce the highest level of evidence. Other limits that I applied to the search included the English language, publication years 2003 through 2014, ages 12 to 18 years old, use of Boolean operators and or, and source types including journals, reports, dissertations, and theses. I purposely applied the population limit so that all of the sample populations would be applicable to my PICO question. However, I did not limit the location where the studies were conducted, such as outpatient versus inpatient facilities, and this produced some discord in the results. 4 of the 8 studies were conducted in controlled research centers. I feel as though the results from these studies might be difficult to implement into primary care practice since it is not the same type of controlled, regimented environment as a research center. Only studies that had a sample size greater than 40 participants were considered. After I gathered my 8 final research articles, I then critically appraised them using the Johns Hopkins rating tool for both evidence and quality. All 8 of the articles included RCTs and were level 1 evidence. 5 of the articles were A quality, while the remaining 3 were B quality. Based on these high levels of evidence and quality, the articles were deemed noteworthy and useful in answering my PICO question. 7 of the 8 articles supported the use of pharmacological therapy in reducing body mass index, BMI, among obese adolescents, as they produced statistically significant results. Only 1 article did not support the use of drugs due to statistically insignificant results among the sample group. The 2 drugs that were studied in the RCTs included sibutramine and orlistat. In the majority of the studies, the drugs were implemented as part of a weight loss plan, which also included diet, exercise, and behavior modification. Both the control group and experimental group were educated on lifestyle modifications. The results suggest that implementing sibutramine or orlistat into a comprehensive plan that also includes a healthy diet, exercise, and behavior modification will reduce BMI among obese adolescents. However, due to lack of follow-up of these studies, there is little research on the long-term effects of these drugs on growth and development as well as long-term weight loss success. This raises some concern since adolescence is a time when the body is going through many changes and growing into an adult. Thus, the implementation of these drugs into my practice as a nurse practitioner will require careful monitoring of the adolescent's growth. I would have to make sure that the benefits outweighed the risks on a case-by-case basis with my patients. Barriers to implementation. There are several barriers that I can identify related to the implementation of these weight loss drugs into pediatric practice. First, there is no way to safely prescribe these medications without FDA approval. Currently, orlistat is the only drug that is approved by the FDA for treatment of obese adolescents ages 12 years old and above. Thus, sibutramine would have to gain FDA approval as well in order to be prescribed to patients. Next, the usage of these drugs to treat adolescent obesity would have to be incorporated into the clinical guidelines in order to be respected among providers. Creating or altering a current guideline is very time-consuming and requires the inclusion of many levels of expertise, including several physicians, nurse practitioners, pharmacists, a reviewing body of professionals, etc. Lastly, I could see medication compliance being a barrier to implementation. As previously mentioned, some of the studies were conducted in the controlled environment of a research center. Primary practice is not nearly as controlled. Once the patient leaves the office, he or she is free and able to do as he or she pleases. Unless the adolescent's parents are adamant about their son or daughter taking the medication, I could see problems with compliance among these teenagers. Also, the drugs unfortunately produce some unwanted gastrointestinal side effects such as loose stools and abdominal discomfort. These side effects could interfere with compliance as well. I think that this would be my toughest challenge. Many teenagers only live in the moment and see their life as it is right now. I'm not sure that I would be able to get them to see the big picture, that these drugs will eventually improve their overall health and decrease their risk for heart disease and diabetes. I fear that they will only hear the detail that they will have diarrhea and abdominal pain, and that this will prevent them from complying with the medication regimen. Suggestions for future research. Due to the lack of research on long-term effects of these drugs, I would suggest the execution of future EBP studies pertaining to these effects. More specifically, longer studies should be conducted on the effects of sibutramine and orlistat on growth and development, as well as long-term success of weight loss. All 8 of the studies were significant for decreasing BMI over 6-month periods, but failed to follow the participants any further after 6 months. The ideal situation for future research would be a clinical trial that is also a longitudinal study and involves several obese adolescents who are patients in my practice. I would get other practitioners on board with my study, obtain a grant to finance the study, educate and consent the patients who volunteer to participate, prescribe the patient sibutramine or orlistat for weight loss, follow their change in BMI, growth and development, blood work, side effects, and adverse effects for several years until they reach a healthy BMI. I would not use a placebo group due to ethical considerations. Although this does not sound like the ideal research study, I think it is the most reasonable one to conduct in a real-world setting, such as a primary care office. Also, by following the patients myself or having my peers follow them, I will gain trust among them and attain the satisfaction of watching positive results over time. The importance of research in practice. Research is crucial to the advancement of practice, and thus the progression of safe and effective patient care. This class has opened my eyes to the importance of evidence-based research, and I plan on utilizing the material that I have learned into my future practice as a family nurse practitioner. Before taking this class, I would often Google a question that I have on the internet to find answers. Now, after taking this class, I know reliable databases that I can utilize as a future practitioner, as well as how to assess the evidence and quality levels of the research articles that I obtain. Although I have no intention of conducting my own research study, I feel like I have a better appreciation of those who do put in the time and effort to do so. Due to their desire and passion for research, I will be able to provide new and exciting care to my patients in the future. 10 years from now, when a patient questions why I am prescribing a certain medication or performing a certain test, I will be able to confidently reply, quote, "Because evidence-based practice suggests this." Thanks, everybody. Have a great holiday. It was nice meeting you and working with you this semester.